I got a groundbreaking new thought process, a new construct for people to work off of.
Okay.
So when I say 2020, what do you think of?
Vision, typically.
Correct. Vision, which is good. 2020, I guess theoretically you can have better than 2020 vision, but typically 2020 vision is like, man, 2020 you can see everything's clear, wonderful.
Mm-hmm.
If you have less than that, then you put glasses on and you go to the eye doctor and they'll do their test, and you were in a blurry world and all of a sudden you can see clearly.
Right.
Now, 2020 breathing is a different concept, which is basically a lot of the folks that we treat and help don't know the blurred up, messed up breathing life they've been living until we get them better. And so it's really the concept of, really trying to set the bar out there that you should be breathing clearly. If it just as everybody, I think, aspires to having, good vision, because it's important to have good vision, to see, to read, to do all the things that you want to do in life. It's just as important to have proper breathing.
Mm-hmm.
And yet nobody ever thinks about it. It's sort of out of sight, out of mind. I would even venture the bet that a lot of folks who go and seek help, go to their doctor, trying to get their breathing better, are dismissed. Meaning, versus somebody who, I guess back to the analogy, if the world is blurry to them, and you went into any doctor, PA, NP, and say, man, I can't see, everything's blurry. What are they going to say? Hey, go to the eye doctor, get your vision checked out, and
100%.
see clearly.
100%.
On the flip side, I'd say you go to your doc and you say, man, I can't breathe properly through my nose. What they're going to do is they're going to say, hey, try this thing that they know isn't going to work, and get out of my office because you're kind of annoying me. Kind of thing. It's the truth.
It's
most of our
unfortunate,
patients,
but
it's
it's true.
unfortunate. And so, and to me, it's really like, I think we need a construct that people can identify with. And I'd say, okay, well, 2020, in a way, and I mean, as we're thinking through this, it's sort of like, you could say, well, 2020 could be, from a nose standpoint, 20 on the left side, or 20 on the right side, 20 on the left side from a breathing standpoint is optimal, and anything less than that is suboptimal. And there are issues that can happen on the inside of the nose that can compromise somebody's breathing, but our goal is to get somebody as close to that optimal 2020 breathing as we can. So what do you think about that concept?
I like it. I like it a lot.
Yeah?
Yeah. I mean, it makes sense. And I think that, and it's always that, what is perfect breathing?
Mm-hmm.
Which is an interesting question to ask anyway, because most people, again, they know their own baseline. Some people are aware that their breathing's not very good. Others are less aware, and it's just, they believe that it's just the way that they are.
Yep.
Right? So it's communicating, what does that mean for patients?
Right.
And then also understanding that there can always be little ebbs and flows around whatever that near perfect baseline is.
Sure.
Right? But we want to get it as optimal as we can, as much as we can.
Yeah, and it depends. I mean, I think there are times where it's a calculation on, to me, I guess what I would say, like, what does 2020 breathing mean to me personally as a nose doc? To me, 2020 is really both sides equally divided. So to divide the nose, your septum divides your nose into two, and so if somebody's septum is reasonably in the middle, okay, we're starting up at a good point. And there's enough breathing capacity down both sides of the nose where the passageways are open, where you can keep your mouth shut, you can breathe, and you're pulling roughly equal air through both sides of the nose. That's as good as you get. Basically, you're taking your nose and you're making equivalent to dropping your mouth open, kind of a concept.
Right.
And I think, which is ideal, like that's great. And then anything less than that, you start going down that list. You get a deviated septum, you start knocking yourself down. You get enlarged turbinates, which mean the passageways through the nose are too narrow, knock it down. Sinuses are plugged up, knock it down. And a lot of folks are knocking it down. They're living lives where it's constantly knocked down, including other issues like allergy issues will certainly knock you down from 2020. And so for us as a mindset, it's really trying to get somebody optimal by whatever means necessary. And I think that, again, though, the power in that is because it's stuff that unfortunately gets sort of diminished, dismissed, swept under the rug. A lot of folks are just sort of going through life not knowing what it's supposed to be like. And I mean, how many times do we see people on the back end? It tends to be procedures on the back end of a procedure where it's, you kind of, I don't know how to describe it. It's almost like you can feel like the chains are off of this person. They're happy and happier in a way that I didn't really understand that noses could make somebody, if it makes sense.
Yeah, absolutely.
Which is cool, and I think you see that one time, and it's like, that's great, and you see that all the time pretty well. I mean, most of the time, most of our patients have those sort of dramatic changes, which is wonderful. And it's really, sort of basically, from my vantage point, makes me want to get the word out on,
Yeah.
you don't have to live that compromised life. You can live, again, to me, life happens to you sometimes, and meaning that for everything everything in your body, everything in your life, trying to get it as optimal as you can is great. Some things are out of your control. There are things in life that you're dealing with that that you just can't get it in that optimal level. This isn't one of them.
No.
Typically, I mean,
Right.
it's a rare instance where we can't take somebody's nose that is suboptimal, that's less than 20/20, and get it up to where it needs to be. So this is sort of a burden or barrier on somebody that is correctable.
So if that's 2020 breathing is both sides of the nose working well. So then what would 2020 sleeping be? Would it be getting nose working 20, throat open 20?
Yeah, although I'd say it starts with that first thing. Starts with you cannot, from a sleep standpoint, you can't have 20/20 sleep without 20/20 breathing. And meaning back to that start of the airway. To sleep properly, you've got to be able to breathe properly, and the only way to breathe properly is through your nose, mouth shut, nose open.
Right.
And so, by definition, you can't be there unless the nose needs to be optimal and optimized. Which again, I mean, the nice thing nowadays is we're talking. It's this weird, massively impactful situation for a lot of folks that we can resolve and help with minimally invasive procedures.
Right.
It's that weirdly sort of it's just almost unfair that people. To me, it is unfair that somebody's walking around the world with tools that are hindered and hampered, where the fix is simple.
Yeah.
Kind of a thing, and it's just a matter of I think
Getting the word out.
getting the word out, and also, I mean, part of the attitude that I have, and I think we tend to have, is a little bit of how do you say this? That I think a lot of people settle, and my attitude for folks is, if that's what you want to do, settle. But if you're settling because there's something you didn't feel like there was anything you could do about, and in this particular area that we could do a ton for, that's not like, it's almost like, being somebody's champion is what we need to be, because a lot of times people are their worst own champions. They tend to kind of just accept what should be versus aspiring for what should be.
And so 2020 breathing is a good concept that can get them there.
I think so. I mean, we'll see. I mean, I think that's a helpful concept. Now, it also just so happens to be the year ahead of us, so we'll see if that kind of plays into some of that,
Sure.
Some of the talk or the thought there. But it doesn't hurt. And I think for us simple old and younger nose doctors, having a bar to work towards is good. It's helpful. Don't let the eye doctors have all the they've got a nice standard that everybody knows about. From a nose standpoint, nobody really knows anything about anything, and it's sort of this tucked away, hidden areas that there's just a lot of dark, and I think we can be sort of some light shining on that. So, but anyway, 20/20 breathing. We'll hit that topic or get some more meat around that topic as we move forward. So hopefully you guys have it, and if you don't have it, we want to get you there.